Hello everyone, thank you for joining this morning's webinar. My name's Amber and I'm the rPlace Programme Officer for Communications. I wasn't in post when the rPlace team ran an RM induction day in May, so this is the first time I've had the opportunity to link with RMs on this year's programme. Welcome to OP 1516. I hope you can all hear me. I'm here to help facilitate today's logic model webinar, especially for relationship managers. And shortly I'll be handing you over to David Morris from New Economy, who'll be talking you through all things logic model. As you should already be aware, the submission of a logic model is the first key milestone on this year's programme. And indeed, the operational plan aside, it's the only key deliverable. One of the lessons from last year's programme is that an area's logic model is a critical element in the development of their operational plan. So it provides the opportunity to energise and rally support for proposal by declaring precisely what an area is trying to accomplish. The logic model will also help the rPlace team determine whether or not an area will be required to develop a cost-benefit analysis later in the year. Support is available to areas to help them develop a logic model. I mean, that's you. And over the past few days, we've run 2 logic model webinar sessions specifically for areas, and all areas have access to written guidance and exemplar models from last year's programme. And additionally, we ran specific logic model sessions at recent induction events in London and York. So there's plenty of support available for areas, but we do feel that relationship managers have a vital role to play in ensuring areas see the value of producing logic models and deliver one that's focused and fit for purpose, providing a clear picture of what the proposal is about, highlighting inputs, outputs and outcomes for the community. So before I hand over to David, I'd just like to go through some of the housekeeping with you. I'd like to let you know the presentation slides you can see on screen today will be emailed to you after the session so that you can take a look at them again. And during the presentation, we'll be running 2 polls, and this is a chance for you to provide some feedback. When we run the polls, you'll see a blue box appear on your screen, and all you need to do is select the option that relates to you and click on it with the mouse. And we'll also be having some question and answer sessions throughout the presentation. So if you have a look on the bottom right hand side of your screen, you'll see there's a control panel. In the bottom half of that panel is an area for you to type questions. We'll also be pausing to answer some of the questions you're sending to us. Any questions that we don't get the chance to answer or can't answer immediately will be addressed outside the session. We'll get back to you during this week. Can you, in terms of questions, are you able to let me know if you can, who you are and if you can hear me? Because I haven't done this before. So if you wanted to type in hello, and then put your name, that would be great. Let's see if there's anything going there. So hi Michelle, you can hear me, thank you. That's a great start. So what I'll do is I'll hand over to David now for the first part of the presentation.
Thank you, Amber, and good morning, everybody. Welcome to the webinar. Some of you I may have met previously, either on last year's rPlace programme or at one of the recent induction events. So hello again if I've met you previously. For those of you who haven't met, so I'm Head of Evaluation here at New Economy. We are one of the partner organisations who work with Locality to support the rPlace areas in undertaking various technical tasks around preparing their operational plan. Today's webinar builds on the information that I provided to attendees at the York induction event a few weeks back, and Sue Holloway and colleagues from Pro Bono Economics provided at the London induction event. As Amber said, we ran a few of these webinars yesterday and last Thursday for areas, and I explained to them that the purpose of the webinar is to go into more detail than I and Sue were able to at the induction events, explaining to them exactly what each part of the logic model template is about and what they need to put in each part of the logic model, and also introducing a different worked example. The worked example we're going to talk through today is in relation to a health initiative, one of the rPlace pioneers in 1314 in East London in Tower Hamlets. So we'll use that as the worked example. So areas should be aware of this worked example if you reference two of them. They should also be aware of the induction event worked example, which was around a jobs initiative in North London in Camden. So they should have already a few worked examples to hand of how to complete a logic model, and hopefully those will be of use as they go about completing their own logic model over the next 4 weeks. In terms of the structure of today's webinar, we're going to be about 90 minutes max. I'll spend the first part of the webinar introducing the logic model template, so explaining its layout and how it flows, and taking some time to look at what needs to go in each box within the logic model template. I'll then introduce the Tower Hamlets Poplar example from the 13-14 Trailblazers on the rPlace programme. So I'll tell you a bit about the challenges that partnership faced when they started working a few years ago, and the response they developed to those challenges, so focusing on the management of diabetes and healthcare issues. So I'll introduce that example to you. And then we'll take a step-by-step approach of applying that example to the logic model template. So looking at each box in turn and saying, okay, from the Tower Hamlets example, what needs to go in this box? What needs to go in that box? Once we've completed that exercise, and there'll be breaks throughout that for question opportunities, I'll give you a few tips for completion as I term them. So if an area is struggling to complete their logic model, some tips you can give them, and also some checks and balances, if you like. Once they've made a first stab at completing their logic model, some questions that you can put to them that they can ask themselves to make sure they've got the best possible logic model when they submit it at the end of July. I'll then just finish up the webinar by looking briefly at how a good logic model can make cost-benefit analysis a lot easier. As Amber mentioned, in September time, a number of the areas, not all of them, but a number, will be asked to produce a cost-benefit analysis of their proposals. If they have a good logic model with all the sections filled in, and including numbers and data, that makes the cost-benefit process a lot easier. As Amber mentioned, they will also have one-to-one and other support in that process, but a logic model is a great first step. And then we'll just finish up with last chance for questions, and Amber will remind you of the timetables for completing and submitting the logic model, and then moving on into the autumn, the remaining rPlace activities. Before I go on to explain to you the logic model template that the rPlace programme uses, I'd like to launch a poll question first, just to gauge the audience's knowledge of logic models. So the question that is put to you is, so what knowledge do you have of logic models? 4 answers there, so don't know what one is, I have heard of one but that's it, have limited knowledge, or have quite a lot of knowledge. So if you could just answer that question, we'll just track the number of responses. I open my poll here. Okay, so about half of you have voted, 80% of you have voted, 90%, that's great. Right, so all of you have voted, that's brilliant. So Amber, if you could close that poll and launch the results so everyone can see what we've been answering. Okay, and if you share that, if you can, right. So in terms of the results, it's not coming up on the screen, but I can describe it over the audio to you. So about a third of you are saying that you've heard of a logic model, but that's it. A similar number saying you have limited knowledge of logic models, and just over a quarter of you saying that you are actually quite knowledgeable about them. That's encouraging to see. There we go, the poll results are on now. So none of you are coming at this completely cold. So hopefully what I talk about will ring some bells. Don't worry, for those of you with limited knowledge, if the logic model I introduce in a minute looks different to the logic models you've used previously, that's not a problem. I'll talk you through that. And for those of you who are knowledgeable, hopefully this will just be a refresher of that knowledge. Okay, So if we could hide those results and come back to my screen, there we go. So I'll move you on now to the template that the rplace project uses. So the rplace project requires areas to fill in this logic model template. And the reason that we have only one logic model template, and there are many out there, is really for ease of comparison across areas. Jim and the team at Locality will be receiving 70, 80 of these, and to have it in a consistent format means it's easier to group areas, can identify areas that are focused on similar issues. We can compare across areas as well and understand the scale of activities in one rplace partnership versus another, or the scale of outcomes that they think that they might be able to deliver. So it's really useful for us as a management tool to have a single approach. As I mentioned, there are lots of different logic models out there. If you Google logic model templates, it will bring up lots of different images and examples. Some flow from top to bottom on a page, so starting at the top with conditions and ending with impacts. Others flow left to right. This example, the one that the rplace program uses, is circular. So we start in the top left-hand corner, looking at the conditions that an rplace partnership are faced with, and which they would seek to challenge, and they end up in the top right here, following the arrows round in terms of intended impacts, so the changes they want to see within the community. In terms of that journey around the circle, this logic model and all logic models are essentially asking three things, or doing three things. Firstly, they're showing what is wrong in an area or within a community. So it's identifying local challenges, data that evidences those local challenges, and showing this is what is wrong within our community. Secondly, it's explaining the steps that will be taken to correct what is wrong, so the activities that are going to be funded, that are going to be delivered. And then thirdly and finally, it is describing the outcome if those steps are successful. So will the original conditions, the original challenges be overcome thanks to those activities? So if you think about it, it's really a virtuous circle. It's saying that this is the problem, this is our response, the outcome of our response will remove the problem. So if our program is successful, it should remove the need for future programs. It will create a more sustainable, reliant community, self-reliant community. So, and all logic models essentially have those three components. In terms of this example, this template, I'm just going to take some time talking you through each part of the diagram. So let's start in the top left-hand corner with conditions. Sorry, just get forward that. There we go. In this top left box, you need to include three things. Firstly, in terms of local context, we need this box to provide evidence of the issues that are faced within a local area. So examples I always cite, data on local unemployment rates, data on rates of ill health or hospital admission, data relating to crime and antisocial behaviour activity, for instance. That's the kind of evidence that you need in this box. It's also a good practice to not just include a snapshot of the current evidence, the current data on a local area, but also to try and include trend data and comparison data within this box. So can your partnership show evidence that the issues that they're faced with have been getting worse over time? Can you support them to access trend data from the Office for National Statistics, from the local authority, from the NHS Trust, for instance, which shows the trend in incidents and outcomes over time? Likewise, can you get them to benchmark their area's performance against another district, another county, another urban area which may be quite similar in makeup? And by doing so, can you show that the issue is relatively more pressing in their rplace area, and hence, if we can only spend money in one area, we should spend it in this area? So that's the first thing this box needs, data. The second thing that it needs to include is reference to the various national and local policies that influence how local areas, how communities think about an issue and how they might respond to them. So an example here might be the reorganisation of the NHS and the increasing role that GPs have in terms of commissioning services from the private and the voluntary sector, and moving towards a more tailored approach to healthcare. So not offering all residents one size fits all, this is your prescription or this is your procedure, but trying to think more generally about wider determinants of their health. So you might reference that in here, for instance. You might reference local council strategies around regenerating a neighbourhood or an estate, or developing certain parts of the economy, or reducing youth unemployment. All these policy documents, they will prioritise an issue, they will describe how partners would like an issue to be responded to, and you need to cite those and show how your proposals fit within those policy contexts. So that's the second thing you need in this box. The third thing that you need in here is some kind of explanation or description of what needs to be in place for those challenges to be overcome and for those policy aims and ambitions to be met. So do local residents need to adopt a new attitude to how they engage with service providers? Conversely, do service providers need to realise that they don't know enough about the local communities that they're working with and commit to devolving decision making to community leaders? So what has to happen on the ground for the initiatives that you're going to describe lower down in the logic model to be a success? So those are the three things that we need in the top left there. Moving down to consider the bottom left-hand box, this is where you describe the nuts and bolts of the R-Place Partnerships activities. Firstly, in this section of the logic model, we need you to set out, or we need your area to set out their high-level objectives. So this is quite straightforward. Often there'll be something like a business case, or there'll be a statement somewhere, or a local authority strategic objective, which will set out in simple terms, often bulleted, over the next few years, our intentions are X, Y, and Z, to create sustainable opportunities, sustainable employment opportunities within our community, for instance. That will be a high-level objective. No need to go into too much detail about who's going to do that, how they're going to do it, over what time scale, just that high-level bulleted objective, which really frames the axis of vision for the R-Place Areas activity. So in that box, get the partnership to set down their objectives, and then underneath that, we need to set out the means by which and the activities by which they'll go about trying to achieve those objectives. I'll just skip over rationale for now and come back to it in a minute. Firstly then, looking at inputs. So in the inputs box, you should ask the partnership to list all the funding, staffing, equipment, facilities, etc. that they will be using from April 2016 onwards. I should have said that. Remember, we're getting our place partnerships to fill in a logic model describing what their activities will hopefully look like from April 16 onwards when they go live, as it were. So from April 16 onwards, what staffing, what funding, what resources will they have available to them to undertake their activities? Some of the more well-resourced areas might have dedicated staff, so full-time officers. Others may be relying on staff secondments or officers in other agencies, such as the Health Trust or perhaps the Registered Social Landlord, giving 1 or 2 days a week of their time to support activity within a neighbourhood or within a community. In those instances, in the inputs box, you should cite something, 0.2 FTEs. If you've got somebody 1 day a week, so you've got 20% of their time, or if you've got someone 2 weeks in a month, so you've got half of a full-time equivalent officer there working on the project. So cite officer input, cite the funding that they may have available to them, so whether that's direct grants from statutory agencies or investments or reserves that they can call upon to deliver activities, and also list inputs in terms of venues, equipment. So maybe it's IT equipment. It might be that a community centre is going to be used to host weekly events and activities. So those all need to be listed in this box. You should also make sure that the partnership includes within this box any resources that are going to be given in kind. So resources where no bill is going to be charged to the partnership. We say that you should count those and you should try and put a value on those resources. So volunteer time, for instance, is a good example, because those volunteers could be undertaking paid work elsewhere in the local economy, doing other things elsewhere in the community. So there's an opportunity cost associated with using those resources, and we need to try and understand what that opportunity cost is. So moving on from inputs then, activities. So this is where you list the daily activities that those inputs are going to enable the partnership to purchase. So examples here might be the hosting of community events. It might be running training days that local residents can come to. It might be trips for older isolated people outside the community. Basically, it's the 9 to 5, Monday to Friday, daily activities that the Our Place Partnership should be delivering. There's no need here to put in numbers. You just need to describe the activities. The numbers of activities will be picked up in the outputs box, which we'll come to in a minute. When you're describing activities, don't forget some of the less tangible activities. So, for instance, is the partnership going to set up a community website? If so, that should be cited. Likewise, don't forget the process activities, so the partnerships activities. So, are they going to be meeting on a monthly basis? Is there going to be training and skills development opportunities for partnership staff who are going to be expected to deliver these activities, because they may not be skilled trainers, or they may not have mentoring skills. They may need to develop those. So if there are going to be process-related activities to improve the work of the partnership, those should also be mentioned in this box. Outputs. So as I mentioned, so this is where you put measurable, quantifiable numbers on those activities. So if your proposal involves running training courses, the output might be to deliver 100 training places for local community members. Likewise, if your activities is to host regular community events, in the outputs box you might say 6 community events over the course of the year, or whatever the number might be. By putting a number on your activities, what you're enabling the partnership to do is to keep a weekly or a monthly track, a feel for how well their progress is going. So they should be able to quickly assess and say, actually, we didn't run a community event this month, we've fallen slightly behind schedule, do we need to put in remedial actions as a result, or actually are we running ahead of target and we've got 150 residents on a training course when we actually only thought we managed to have a capacity for 100. So it's those monthly, weekly performance numbers that the team needs to be aware of and needs to track. Just finally then, skipping back to rationale before we move on to outcomes. So the rationale is where you need to explain, or the partnership needs to explain to you, and you need to challenge them on this, why have they designed the delivery of their Our Place programme as they have? To put things another way, why will the problem that they've identified in the top left-hand box not go away if it was just left alone? So why do we need people and public resources dedicated to this issue? To try and illustrate this to you, get the concept of a rationale across. Let's imagine an Our Place partnership says we want to set up a community hub which will host support services from the housing provider, from the local GPs, from local counselling services, and perhaps a parenting class. So lots of different statutory teams and agencies are going to be working in there at different points during the week. And the rationale for doing that, well, we've spoken to people who live on the estate, and they are aware that these services are provided in the town centre, but they can't afford the bus fare, or the services are provided at inaccessible times in inaccessible venues. So as a result, they don't take up that service provision. Our thinking is that by putting this within a well-known community centre, which is open from 8 till 8, and it's got disabled access, it's far more likely that people will take up that provision and that advice, and that advice will have a beneficial impact on their lives. So that would be the rationale for that hypothetical R-Place area. Once you get to know the areas you're working with, challenge them on this point and say, why have you designed it as you have? Are there alternative ways of delivering your intervention? Right, so that's the bottom left-hand box, and that's the nuts and bolts. Just before I move on to think about outcomes and impacts, just a short pause. Right, outcomes and impacts. So outcomes, if the R-Place partnership that you're supporting, or partnerships that you're supporting are a success, ask them what changes are they going to be seeing in residents or the community's lives. Examples of outcomes, so sort of medium-term changes in residents' lives, would be things like improvements in residents' long-term health. It might be more young people entering sustained employment, if the partnership was looking at youth unemployment issues, for instance. It might be a reduction in antisocial behaviour, incidents and disturbances within a neighbourhood or on an estate. So these are medium-term changes that you could ask residents or ask clients about and develop evidence, draw inferences from what they tell you. Don't also forget there will be intended outcomes for the partnership. So by the partnership being more open in helping local people design and deliver services, you might expect to see more residents saying they have a greater say in local service delivery. That would be another type of outcome. Likewise, you might see more people volunteering and supporting the work of the partnership, again another outcome. From an agency perspective, you might see more officers saying that they have a greater awareness of what other agencies do within an area, and that there's closer working, more information sharing between partnership members. Again, all positive medium-term outcomes, successes that result from the activities that the partnership is funding and delivering. The question then is, what's the difference between outcomes and impacts? Don't worry if you're confused by the distinction. Often the two terms are used interchangeably and rather lazily in policy terms and in documents. Perhaps the easiest way to think of this is impacts are things that are measured by other people, whereas outcomes are things measured by the partnership. So the partnership will know its clients and will be able to ask its clients on a regular basis about the beneficial outcomes they're seeing in their lives. Impacts, these are wider still, and they'd be reported by perhaps a statutory agency, such as an NHS trust or a local authority or the Office of National Statistics. So an NHS trust would report numbers of A&E attendances. A secondary school would support percentage of pupils who are truanting from school, for instance. And those two examples, they're impacts. The reason they're impacts is because the R-Place partnership will have an influence upon them. It might help reduce truancy by improving parenting skills. It might help to reduce A&E attendances, again by improving child rearing skills. But there'll be lots of other things going on within the borough, within the district, within the county, which would affect those measures, those impacts. So it's not solely the responsibility of the R-Place partnership to change those figures, to change those rates. So impacts, they're things measured by other agencies, other teams, and they're affected by more than just the R-Place activities that you're supporting. So that's one way of describing it. And I should say that all these descriptions and this explanation, it's included within the Logic Models written guide, and that is posted in the Locality My Community webpage in the resources section, and this includes the detail of what needs to go in each of these boxes. It includes a text box which talks in a bit more detail about the distinction between outcomes and impacts. So if you forget the distinction, come back to that. Right, just moving us on then, tips for, moving us on, I'm going to talk you through now the Poplar example that we're going to use today to populate that logic model template. So the Poplar NCB stands for Neighbourhood Community Budget, and that was just an early acronym for our playstyle activities. The Poplar team were a 2013-14 Trailblazer area, one of the 12. And the area they're working with in was 2 wards in Tower Hamlets, highly deprived wards with high rates of diabetes. So the team did a lot of on-the-street research, and they identified that diabetes and related comorbidities such as obesity, heart disease, stroke, for instance, those were demonstrating very high rates within 2 wards, so Bromley by Bow and Mile End East. The team noted that it was a diverse community in terms of ethnicity, and that influenced how they designed their response in terms of delivering support to the community. And they got data from the local GP, clinical commissioning group, and the local hospital trust, which told them how many residents were being admitted to hospital for diabetes each year, how long they were having to stay in hospital, the cost that was putting upon the NHS trust, and the numbers of residents who were at risk of adding to that burden. So the numbers who were being diagnosed with diabetes each year or who were seen as being at risk. So they gathered a lot of data on the local area and the health challenges that the area faced. And using that data through various workshops, they developed a response, a partnership, community-led response. To summarise that response, it was around the development of primary healthcare packages. So this was the idea that GPs could support someone with diabetes under the old business as usual model. The way they were doing that was by prescribing people drugs, to giving them some advice on weight management and healthy eating. But there was a trend within the Department of Health's work and research into health, which was suggesting that alongside those activities, supporting people in areas such as improving their skills, gaining employment, ensuring that they had good quality housing, that they were accessing the welfare benefits they're entitled to, that they weren't in debt. If you could help people with those wider determinants of health, then people were far more likely to have success at managing the primary causes, the primary symptoms of their health, so managing diabetes, for instance. So the team established this model of GPs referring people on to volunteers who could then develop a package of support for the resident around things such as employment, housing, welfare benefits. The partnership brought the Further Education College on board, and they agreed to provide free training to local residents. So instead of having to pay a cost to attend a level 2 or level 3 training course, that they could access training free of charge, and then hopefully access employment on the back of that. And they decided that they'd create a roster of volunteers to support the work, and they draw that roster of volunteers from the Bangladeshi community, because diabetes was an issue for the community, but they wanted to make sure that people were receiving support from community members and not from a faceless bureaucrat, to use a hackneyed cliche, who was telling them to do things. So they were receiving advice from their neighbours, from their friends, from their community. So that was the Poplar response to the challenges they faced. And what we need to do now is to start to populate our logic model template using the Poplar example. So we're going to fill in the logic model in reverse fashion. So we're going to start in the top right with impact and work our way back to conditions. So starting then in terms of impact, I should say also that if your partnership decides they want to start with conditions and contextual factors and then work forwards or work anti-clockwise, if you like, around this template, that's not a problem. You can complete a logic model either way. Some partnerships, some teams seem to work better at envisaging the future impacts and stepping back from that. Others start with what are the challenges we face and then groping their way forwards in terms of activities, outputs, outcomes. Ask your partnerships which approach they prefer and take it from there. So starting with impacts then, so if we think back then, the first and major impact that this Poplar Harcar team are hoping to deliver for their community is fewer hospital admissions related to diabetes, and where people are admitted to hospital, to making sure that those admissions were for a shorter period of time. So people were returned to their home, returned to the community as soon as possible. There are also other impacts to consider, so the wider determinants of health we mentioned. So we'd expect to see reductions in obesity and inactivity figures. We'd expect to see more people reporting that they had good health and health issues were not limiting their mobility, their accessibility. So we need, in terms of evaluating this, to have some feel for local health metrics. But also picking up those wider determinants, the team were hoping to improve the skills profile. So the numbers of people within the 2 wards who are qualified to levels 2, level 3, for instance, so GCSEs, A-levels, etc. And on the back of that, to see reductions in the local unemployment rates. So some of those newly skilled workers, hopefully they'd be getting a job. And finally, in terms of impacts, hopefully we'd expect to see increased community satisfaction with the services provided to them by the college, by healthcare providers, by the local council. So those are all the sorts of impacts, just a summary of them, that the Poplar Harcar team were hoping that they'd deliver in the longer term to the community. And remember, there'd be other activities going on within Tower Hamlets, within London, which would affect these impacts and the measures of them as well. What about outcomes then? So outcomes flow back from impacts, and in terms of that first impact, fewer and shorter hospital admissions, well, if we're going to achieve that, what we really need is for people with diabetes to be better at managing their diabetes. So to be more knowledgeable about healthy eating and activity, to be more knowledgeable about the drugs that they've been prescribed, and to identify if they feel that a crisis in their health is coming on, and to respond to that quickly and to prevent that crisis from worsening. So it's about people being better at managing and knowing their health. It's about also Tower Hamlets residents feeling that they have less need for NHS provision. So being more aware of how to manage their health, healthy eating for instance, not attending A&E whenever they feel that they are slightly under the weather, but instead taking control of their health. So increased awareness of their health and how to manage it, reduced usage of the NHS generally. In terms of some of those lower down impacts around skills, employment, etc., so the outcomes needed for that to happen, so we need some of the residents to gain qualifications, because if you gain qualifications, you're more likely to gain a job. So we also need our residents to enter sustained employment. We also, if this model's to work, it's based around volunteers. So we'd expect to see more people within the community volunteering. That will be a medium-term outcome of the activity of developing healthcare package approaches, so more volunteering. And finally here, one of the points that came out of Poplar's early research was that the issue of diabetes and ill health was putting a strain not just on residents who did have ill health, but also their family members who were caring for them. So one of the outcomes that the team targeted was a reduced need for carers. So if people were better at managing their own health, that should mean that neighbours or family members were required to spend less time caring for that person and could do other things with that time. So those are the outcomes. just now, we're going to just take a break, a chance for you to put questions to me. So, Amber, if I can hand back to you, can you let me know if any questions have been posed to date for me to answer?
Well,
Amber, are you there?
yeah, can you hear me now? Hello?
Yes, I can, thanks.
Yeah, hi. Hi, everyone.
Yep.
I was hoping you could recap those three elements to every logic model. The first one was what's wrong in an area of the community.
Yes, yep. So the three stages, and these are in any logic model, unless it's been completed incorrectly. So it's firstly about showing what is wrong. So what's the challenge, what's the issue that our partnership is focused on. Secondly, you explain the steps, the activities that will be taken to correct what is wrong. And then thirdly, if those steps are successful, what outcomes will you deliver for residents, for the community, for society, for the local economy, whatever your unit of focus is. So those are the three logical steps to put to partnerships. They should be able to answer the first one, definitely by now, because otherwise why would they have come together? But the second one, in terms of steps to take, outcomes, those are the things that they need to be developing over these coming weeks.
Okay, great. So does everybody know how to use the question system here? If you don't, on the panel on your right, there's a tab with questions, and you can type questions in, and then I'll relate those to David, or he can read them himself, and we'll answer them either now or later on if they can't be answered now. There's another question, David, here, which is how do you talked about higher than expected output? So maybe they've delivered more than they had expected in terms of training activities and so on. How does that? How do you kind of work that with the logic model? Does that affect the other steps?
Not really, no, because when you start working with partnerships and developing a logic model, they're going to be forecasting their impact forwards. So they're going to be saying, we hope that we can deliver this many events or support this many residents who are currently isolated, for instance. And I'd suggest that relationship managers sort of challenge those numbers and encourage areas to be cautious and conservative, because there's always a temptation to say we can help everybody and we'll do it in double quick time. When the areas, perhaps in 18 months, 2 years' time, come back to reflect on their first year of actual activity on the ground, then they could update their logic model. So a logic model is an organic document. They could say, actually, each year we're delivering these many activities, these many outcomes. Also, something to think about, the logic model template, it uses the terms intended outcomes, intended impacts. I have seen examples where people have almost like drawn an appendage on the side and called it unexpected outcomes or unexpected impacts. And then 6 months down the line, when they started doing work, they return to it and they just scribble in those boxes and say, actually, we thought we'd address isolation, but what we've really addressed is debt issues. You know, and our original research wasn't quite on the money. There were wider issues within the community that we're now aware of.
Okay, thank you. That's useful. Also, I've got a question from Norman here. Can some of the activities be started before April 2016?
Good question, Norman. Yeah, I think if there is activities in the next 9 months or so, which are going to be sort of crucial to the successful launch in April, then yes, I would cite them in the logic model. The reason for saying that most of the logic model should be focused from 1st April 16 onwards is because last year we didn't quite make that clear enough in these webinars. And a few R-place areas, not many, but a few, submitted logic models where it described the partnership's work over this coming 9 months. So it was, we will meet on a fortnightly basis. Our output will be one operational plan, one logic model, for instance. And it wasn't telling the review panel, Jim and the team and DCLG colleagues, it wasn't telling us anything about the extent of the problem that the area was looking at, how they were going to be operating. So we couldn't get a feel for what they were doing. So avoid writing about the process that you're going to be going through in the next 9 months. But if there is some preparatory work, such as community open days, where you might be doing some street research, or maybe designing a training scheme for older residents who are retired, so they can become volunteers or mentors to younger people. Now, if that work's going to be starting this autumn, early next year, then yes, I'd include it in your logic model.
Okay, thank you. And so drilling down a little bit, question from Peter. What is the precise role of relationship managers in relation to developing the logic model?
I'd suggest that you might want to come in on this as well, Amber.
Yes, sure.
But I think it's got to be, as we'll see towards the end, I've got some tips on completion, but I think this should be a group exercise in terms of completion for the partnership. So don't let them dump the task on you and say, we've got X number of days of your time, we'd like to use half of those, and you do our logic model for us. I think relationship managers, the best way you can do this is perhaps through facilitating a workshop. That's usually how I do it. So putting the template down in front of areas, explaining it to those attendees who haven't been on one of the induction events or listened to the webinar or read the online materials, and then taking an hour or so just as a group, or split them into small groups, start filling in different bits of the logic model. And I think that's really useful because it helps areas to see actually, or team members within a partnership see, my conception of what this is about is different from my colleague's conception. And you can develop a further, better understanding of your process by doing that. So that would be my suggestion. You will need probably to support them a little bit, but don't take it all upon yourselves. See it very much as a facilitating a workshop kind of approach. Amber, you might have something to add to that, I don't know.
Yes, certainly. One thing is that deadline's really quite soon. So the 24th of July is the deadline for the groups to submit their completed logic model to the rplace at locality.org.uk email address. So it's really kind of your first meeting with them, which is coming up. You need to get them to focus, keep everything running on time, to engage them, motivate them to do this, and let us know of any concerns. So your first report will be about the capacity of the group, and that's due in mid or late July, the report, but hopefully you'll have met them sooner and helped them complete a logic model as David described. If there's any issues at all, let us know straight away. And in terms of support for the groups to complete the logic model, just to recap some of that, on the My Community website, under the Our Place tab, there's a list of resources. I'm sure you've explored those, and one of those is the Logic Model Guide. And we've just, yesterday we uploaded an A3 Word version of that as well. So that's going to be probably the easiest way for the people to physically fill that in. They can get quite a lot in the A3 Word, and then they can email that as a PDF or JPEG or even a Word document. Hopefully that answers your question, Peter, and anybody else who had the same question. Just send in further questions as they come. Should we go back to the presentation, David, at the moment?
Okay, yeah, let's move on. Thanks, Amber. So if we all remember then, we completed the impacts and outcomes boxes of the logic model using the Poplar example. Now we're just going to describe the nuts and bolts of Poplar's work over the last year and ongoing, as I understand it. So in terms of the outputs that they were going to measure themselves against to deliver those outcomes, discussions with the clinical commissioning group locally, they agreed that GPs would help them to develop 2,000 of these healthcare packages. So over a few years of activity, based on the prevalence of diabetes or people at risk of diabetes in the communities, the GPs committed to helping 2,000 of those individuals onto a healthcare package. And that was based not just on an arbitrary number, but they had discussions about the length of a GP appointment, working out how long it would take to develop a healthcare package, and the clinical commissioning group committing to say, okay, we'll spend, instead of giving an appointment 15 minutes, we'll give those appointments 30 minutes or an hour or whatever it was, because that gives us more chance to develop the package. So 2,000 care packages, and linked to that they said, well, how many volunteers are we going to need to work with those individuals on healthcare packages? Now, not all of those 2,000 individuals would start on the programme on day one. There'd be dribs and drabs over the course of a year or years. So they've worked out that they'd need about 50 volunteers trained up, each working with a few local individuals to help them on that healthcare journey. So that was another output key performance indicator for them, 50 volunteers. Just finally, this isn't all the outputs, but for space sake, I've narrowed it down to 3. They also engaged in negotiations with the local further education college around training residents, and it was agreed that of the 2,000 clients who were supported onto healthcare packages, 300 of those with skills and training needs would be able to access training at the local college free of charge. So the college would, with support, provide 300 training places free of charge. So those are some of the key output measures that the team were aware of and which they measured their progress against month by month. The activities then needed to deliver those outputs, well, the obvious one is if you're going to produce 2,000 care packages, day to day, there's going to be those meetings between the GP and the resident to develop a care package. So that's going to be needed. If we're going to be running 50 volunteers, then we're going to need some activity around volunteer support and training, because there isn't just a ready-made batch of 50 volunteers out there with exactly the skills and knowledge we need. We're going to have to do some regular training and support for those volunteers. We're going to need the local college to develop and deliver training for our 300 residents who are supported on that part of the programme. But also thinking about the process activities, we can't just launch in April and expect residents to know that this service is available and to demand it. We're going to need to publicise this new approach. So we're going to need hard copy materials. I think the Poplar team used the housing provider website to set up a dedicated part of that website which explained the process, gave people more information, not just on the healthcare package process, but also just general healthy living information and ideas about training and accessing debt and welfare advice, for instance. So there was publicity type activities as well that they were undertaking daily. The inputs that the partnership had available to them to deliver those activities, being one of the earlier Our Place areas, one of the initial 12 trailblazers, they had slightly more resources available to them than the larger numbers do nowadays, unfortunately. They had dedicated staff from the social landlord, so a few members of staff from there were seconded in or transferred over to the new approach. We've mentioned that GPs from a clinical commissioning group locally, they committed to giving more time to the programme and not charging for that. So it was an in-kind offer of extra appointments almost, if you like, and that was costed and quantified. The volunteers, so those 50 volunteers, they were giving their time free of charge. They are giving their time free of charge to the programme, and that needs to be noted and costed. In terms of the venue for delivering training and support activities, again, the social landlord had a local venue, the Burdett Centre, which they gave over rent-free to the activities, and they said you can host training courses, you can have volunteer meetups in the centre. So that was included in the inputs. And there was also some central government grants, so the Department of Work and Pensions gave a grant to help cover the cost of training unemployed residents. So that was another one of the key inputs to note. There they are. So moving to the to the back end of this section. So the rationale, so why deliver these care packages? Why not just leave things as they are with GPs prescribing drugs, welfare advisors advising on welfare, people turning up at the hospital if they have an issue? Why do we need to change things? Well, in the rationale box, 3 key reasons were cited. Firstly, the team cited their on-the-ground research. So they noted that issues of diabetes and ill health were getting worse within this community. And this was a poor community already, so it was facing considerable challenges that other parts of London weren't facing. So the issue's getting worse. Our current way of dealing with this is not working. We need a new approach. So that was rationale 1. Rationale 2 was that Department of Health Research, others, the King's Fund, is increasingly showing that there are multiple causes of poor health. So it's not just someone's weight or their lack of physical activity. It is also their financial situation. It's whether they live in an overcrowded house, for instance. So we need an approach which is more than just prescribing drugs or treating people at hospital. We need that to be linked into advice around the wider determinants of health. And this approach we've designed with GPs starting the process, but then volunteers following it up. That picks up those multiple and tackles those multiple causes of poor health. Finally, this approach with volunteers is far less prescriptive. It's more flexible than how services are currently delivered. So at present, if a resident has a debt issue, then they might go to Citizens Advice or their local council money advice service, and they can get a certain style of support in a certain way. And there will be no recognition, well, probably no recognition when that support is being delivered, of how it might link into someone's skills and training issues, how it might link into their weight and healthy living issues. It will just be delivered as a standalone service. If we have volunteers helping people to manage their access to different services, what they're getting then is a bespoke, tailored support package. They'll get interventions in the right sequence, when they want, where they want. It's far more likely that we think that approach will be successful. So that was rationale 3. A tailored approach is more likely to be more effective. Just finally then, in terms of programme objectives, so the team set themselves 3 high-level programme objectives. So this was the vision that they'd expound to anyone who wanted to know, what are you doing in terms of our place in Poplar? And they said, well, firstly, we're delivering care packages with community support. Secondly, we're developing a more cost-effective way of managing health within our neighbourhoods. And thirdly, we're looking to develop a way of managing health which can be replicated all across London. So they acknowledged that this isn't just about objectives for their local community, and there's a wider process objective around developing a cost-effective, replicable model which other parts of the capital, other parts of the country could quickly copy, could scale up if it's proved to be successful. So those were the high-level programme objectives, were front and centre of their operational plan and were included in their logic model. Just going to break now, a chance to pick up any questions that have been posed since the last break. So Amber, is there anything that I need to answer?
There's one very straightforward question, which is who submits the logic model to Locality? Is it the relationship manager or the partnership? And the answer is it will be the partnership. And then
okay.
I'd be interested to know if an area has more than one theme, how many logic models they submit. So I believe they submit 1 per theme, but perhaps if you could just explain that a little bit more and kind of the maximum amount that we might expect for the Our Place.
Yep, I can talk through that. Just to let you know, 11 o'clock, I think we're due our weekly fire alarm test. So if the fire alarm does go off, I will just sit quietly for the 20 seconds until it's finished.
Okay.
Okay. So the question was, if an area, if a partnership has multiple themes, should they submit 2 logic models? The recommendation is yes, they should. To give an example, last year we reviewed a few areas where they tried to get everything into one logic model. And one example I remember They were working in a village, I think it was, and some of their work was around helping young people within the village get into work, because there weren't many work opportunities. There wasn't any transport for people to get to work in the mornings or home in the evenings. But there was also some work the partnership were doing around reducing isolation. So older people who might have been widowed, who were isolated in that community. When they tried to put that all in one logic model, to the casual reader, you looked at it and you said, well, is it that the young people are isolated and they're going to be receiving daily support, and the older people are going to be given mopeds to get around the village, or is it the other way around? It wasn't. Because the logic model doesn't come with necessarily written text around it. It was hard to work out. So in that example, we went back to them and said, split it into two. One logic model describing your work with older people, one logic model describing your work with younger people, just for ease. The only time when that can get a bit complex, I suppose, is when there's only really one set of activities and outputs, and the objectives might be quite broad, in terms of improving community cohesion, for instance. There could be lots of work within that. When you've got that kind of situation, then perhaps stick with one logic model, but make it clear in the intended outcomes box which outcomes relate to which residents or clients of the service. So perhaps just annotate the logic model and say, these are outcomes for people from a specific ethnicity, or people of a certain age, or who face certain health issues, whatever it might be. So in that instance, just keep it with one logic model.
Thank
but generally,
you.
the more logic models you think make it clearer, the better.
Okay, but also just to emphasise to the relationship managers that we want the groups to try and narrow it down to one or two themes as well, because that will make it much easier for them to complete their operational plan for the funding they have. I think people want to make a big change, and that's great, and we need to keep them focused on making a small change that's really going to work. So yeah, one, two, three themes, 1, 2, 3 logic models as well. Have another question as well, which is about the poplar example. Asks Richard, is it indicative of the level of detail required?
No, the popular example that I'm developing today, I boiled it down to time and for space purposes. I'd expect logic models submitted to have a bit more detail than what we'll end up with today. Not reams and reams. You don't need to be writing in sort of 6-point type and putting everything in. The test really should be on whether you've got enough information or not, is to give it to someone who doesn't know the RSAFE partnership and say, I'll come back in 15 minutes and you tell me whether you understand what this proposal is about. If you come back and they look at you blankly and say, I've got no idea what this is about, then the logic model probably needs a bit more detail, because it's a depiction and it's a description of how logically an area is going to go about tackling the issues they face. So that's the test, really.
Okay, that's great. That's a useful test. I just wanted to, as well, just while I've got the relationship managers on the phone and the question sessions going, is just in terms of helping groups meet deadlines, one thing I'm going to do is try out a text system where I will text them when their logic model needs to come in, and all these different things. And just while the relationship managers are on the line, if you would like to send me your mobile phone number, I can include you in that list, and you'll get the occasional text, the same as the partnerships will get. So back to logic models, David.
Okay, so we just need to finish up completing the popular example. So moving us on then, so we've completed 3 quarters of it. All we need to do is cite the conditions that the team in Poplar were facing and had to challenge. This actually links quite nicely back to that previous question about, is the level of detail I'm putting here sufficient? When we talk about local context here, I haven't put in any specific data. I haven't gone into that detail. I would expect in this box to see a fair few numbers when the areas submit their plans. because that would show DCLG, so Jim and the team at Locality, that the partnership they do really know their neighbourhood or their community or their parish. They've gone away and they've found out, the numbers of residents who have certain issues that could be supported, and it's not just somebody saying, I think this is an issue. So in this box, try and get numbers, percentages, etc. For this example, though, as I say, the local context, the team gathered data from the NHS Trust, from GPs, from the local council, through the various health and wellbeing activities, which demonstrated the poor health experienced by residents in the local area. So things such as obesity, percentage of people saying that they took regular exercise, numbers of hospital admissions for various illnesses and incidents benchmarked against other parts of the capital to show the issue. And they also cited data which showed that the area is quite deprived. So in terms of quality of housing, numbers of people in work and employment, there's the index of multiple deprivation. That's a report published about every 3 years by Department of Communities and Local Government, and that tells you to quite a small level of detail how deprived or how affluent a neighbourhood or a community is. So those are useful stats often to cite. They also cited data from the census and other sources around the profile of the area, so the ages of residents, their ethnicity, their gender, because obviously that informed the numbers of volunteers, the background of volunteers that they were seeking to recruit. In terms of the policy context, the key drivers in Poplar were firstly around the move to clinical commissioning groups, so GPs having greater say over how their time and their money was spent in order to deliver better outcomes for people's health. So that was a key policy driver, which they felt fitted nicely with their approach. They cited health and wellbeing agendas, so Department of Health and others increasingly focused on the idea of being a wellbeing service, not just a health service. So how can we make sure that people's wider lives, that the wider determinants of health are good, so that they then don't turn up at A&E or they don't end up being admitted to hospital for an expensive and intrusive operation. So that was cited, and they also looked at budgetary pressures. So they knew that some of that wider provision around skills and training, around debt advice, around welfare services, around housing and overcrowding issues, the providers of those services were under pressure. So by co-locating them within one building and offering that support in one format, hopefully they could reduce rental costs, they could reduce expenditure elsewhere in the system. So it'd be a cost-effective approach. Finally then, in terms of completing this logic model, so what needs to be in place for change to occur? So the team summed this up quite nicely as this is about people taking responsibility for proactively managing their health. So moving from a situation, a business as usual scenario in which people expect healthcare advice to be given to them or done to them, if you like, by a GP or at the A&E desk, to a situation in which people proactively manage their own health. But also linked to that, the idea that you can't just tell people to do that. You need to give them the opportunities and the resources to do that. So the volunteer support to help them to manage their own health, but also the knowledge, the information, the encouragement to do so. So don't just tell people to manage their own health, give them the resources to do that. So that is the last bit then of the Poplar logic model. And as Amber said, this presentation will be posted on the Locality page, so you'll be able to look at this again. Reference also the written guide, which includes another worked example, reference the induction slides, they include another again. So you should have lots of examples of completed logic models at your fingertips. In terms of advice for helping your areas get to a good logic model, my first advice would be when you're completing the process, and we've talked about this a bit already in the Q&A, see it as a workshop style process. Don't let the partnership assign it to one person or see it as something that you should do for them. So involve as many of the partnership members and stakeholders as possible, because each partner, each agency, each individual will have a different perspective on what the area is proposing to do. And by completing many different logic models and throwing them all on the table, you should be able to develop a more coherent, agreed picture of what your area's activities is essentially about. So a chance to challenge preconceived ideas, I suppose. As also mentioned, include as many numbers as possible when ask your areas to include as many numbers as possible when producing their logic model. That's not just so that DCLG have confidence that the team know their local area. It's also so we can get a feel for whether what is being proposed is feasible. So is the number of residents who need support really great, really large, and actually the number of activities being proposed or the size of the staffing seems too small to support all those residents? You know, is greater scale needed here? Conversely, there's a lot of resources to deal with what seems to be a fairly small problem affecting relatively few residents. I know last year a few of the Our Place areas, which are sort of parish council led and village led, when they actually dug under the surface of the issue, they were only actually working with sort of 5, 10, 15 local residents, which is a very small number to justify a significant investment. So include numbers as possible, and within that try and include trend data, comparison data. Once you've got a good version of the logic model in place, challenge your partnership before they submit it to Jim and the team. Challenge them on these sort of questions. So ask them, is the evidence there to support activity? So, you know, have you found data and evidence that shows that there's a problem? And linked to that, do you feel you have the resources to overcome that issue? Have you got enough staff? Have you got enough equipment? And have you got a venue? Is the logic in this model testable? So if we were going to be evaluating or monitoring your activities, what data do we need to be gathering on a monthly basis? If we're going to be running resident surveys, what questions would we need to put to them to see whether our high-level objectives have been reached? Or are those questions already put to them in alternative ways? So is there an existing neighbourhood survey, or does the GP get regular feedback from their attendees at surgery? Could we use that to understand our impact? Finally, ask a question to them, you know, is this truly meaningful? So these outcomes are obviously important to you, but think about the sort of public meeting test. If you stood up and explained this to people who aren't involved in your Our Place partnership, would they buy into it? Would they agree it's worth the effort? Or is this actually something that this small group of people are fixated with, but it's not actually that important for the community? So challenge the version of the logic model you have. Hopefully that should help them to develop a little bit further, and then submit it into Jim and the team at Locality. I just want to, as we come towards the end of the webinar, think a little bit about how a logic model can support the autumn activities that some Our Place areas will be required to undertake. Once we've reviewed the logic models, probably sometime in August, we'll identify a percentage of areas, partnerships, who will be required to complete a cost-benefit analysis. So your area may need to do a CBA, it may not. Areas that won't be required to do one, if a proposal is very small scale, or if a proposal is going to deliver outcomes which are very hard to put a value on. So outcomes which are around family cohesion, community, or cohesion between different groups within the community. It might be very long-term benefits. So if the focus is on parenting classes for toddlers, the outcomes of that activity could be seen, you know, 5, 10, 15 years down the line when those children are at school or just starting on a job. In those kind of examples, the review panel will probably come to the conclusion that to do a cost-benefit analysis would be disproportionate. It would be too tricky. It wouldn't produce anything meaningful at the end of it. So those areas will be told, don't worry about CBA, just continue with your written operational plan. For those areas that do need to complete a cost-benefit, if they've got a good logic model, then it makes the process in the autumn a lot easier. Though I should remind you that in the autumn there will be webinars on cost-benefit analysis, there'll be training days, there'll be one-to-one support, so areas won't be alone. But if they've got a good logic model, they've got a very good start. To explain that, the logic model, the sections on inputs, activities and outputs, these are in effect the costs of what is being proposed. In the inputs box, it's likely that your partnership will be citing, if not financial investment, so the local authority is giving us a grant of £50,000 or the college is going to give us a grant of X or whatever. They might be citing staff who are going to be working on the programme, so it'd be a fairly easy step to work out the salaries of those staff and say, okay, that equates to an investment of £60,000. They might be citing in-kind support, so volunteer time, and you can say, okay, well, if we assume volunteer time is worth £10 an hour, which is about the average wage, £10, £11 an hour is what you often see, we can quickly cost up the value of volunteer in-kind support for projects. In the activities and outputs box, you might also pick up some other activities which can be quickly turned into pounds and pence figures. So in the Poplar example, we talked about running providing 300 training places. So there's a standard unit cost that the college will receive per training place. So it's quite easy for them to say, okay, alongside the staffing investment that the social landlord is providing to this programme, we are providing you with £75,000 worth of training places, whatever it might be. So you need to add that to your total costs. So using the numbers, the data in those boxes, you should be able to work out a total cost of what's being proposed. And then you can weigh that up against and hopefully show that the benefits outweigh the costs by using the impacts and outcomes boxes in a logic model. The outcomes that an area cites, so it might be things around residents entering sustained employment and not claiming job seekers allowance. It might be around a reduction in the number of residents entering residential social care, so the local authority not having to put them up in a care home, or delaying their entry at least. Those outcomes and many, many more, the new economy cost-benefit analysis model, it can put a value on those automatically. So you and your partnerships don't need to spend ages saying, well, if I get someone off job seeker allowance, how much is that worth? That work's already been done, and it's been applied and used on numerous projects over the last 5 or so years across the public sector. So that information exists. All that you need to do with your partnership is tell the model how many people will achieve that outcome. For instance, as a result of my RPlace activity, 50 people will come off job seekers allowance. The model can then do all the work for you to turn that into pounds and pence figure. So if you, in these two boxes, get your area to fully think about their outcomes and impact, then the model can work out the value of those for you later on in the piece. So good logic model makes cost-benefit analysis a lot easier. I'm just now going to launch a poll. This is for me to test how confident you all now are in terms of supporting areas in the completion of their logic model. So at the start, quite a lot of you said that you're knowledgeable or had some experience. So hopefully none of you are now going to be saying that you don't feel ready to support areas. But Amber, if you could launch the poll for us, please, and we'll give people the opportunity to answer this question and see what impact this webinar has had. Okay, so the poll is now open. Can you start to vote? Okay, so thanks to all of you who have voted. So Amber, if you can close the poll and launch the results for us.
Just do that now. Let's see.
Share the results. That should bring it up for everyone
Might
to
just
see.
be, yeah, there we go.
Yeah, okay. So that's good. So over half of you think that you're ready to support your areas independently to complete their logic model. And I should say that in the webinars with the areas, a clear majority of them were coming away from this saying yes, they are ready to complete a logic model. Slight majority saying that they'd still like some help on that. But I don't think any of them, no, none of them said that they weren't ready to complete a logic model. So you shouldn't start this discussion and they say, oh, we're not ready at all. And a good third of you just over saying that yes, with some help. So as I say, refer to the online guide. Obviously, there's contact email addresses, and put the challenge back to areas as well, saying what did you take out of the webinars or the induction events, and work together on that. That should be good. Whoever answered some of it, obviously email if there are bits of the logic model that it's the case that you don't understand, still don't understand what concerns that an area might not know, the partnership you're supporting might not know their activities in detail, then it's a case of, by the end of July, having as much detail as possible on those activities, but perhaps also acknowledging that there may be some more development work later on in the autumn. Okay then, I'm just going to hand back to Amber so she can just talk you through the timetable that the areas are expected to work to.
Hello everyone. Thank you very much, David. That was great. So these are the logic model webinars. So just to recap, the groups will have done webinars and they will have probably also attended the induction. Hopefully there won't be anybody that hasn't, but do let us know and we can perhaps do some more bespoke work with them if you feel you're not quite ready to do that yourselves. Submission of the logic model is the 24th of July, so that's less than a month away. And just to be a bit clear on that, we definitely want all the groups to stick to an A3 sheet of paper and turn that into either a PDF or a JPEG or send it in Word, and not to change the format and also not to use a different, although David did describe different types of logic model, we want them to use the one that we've provided on the website. And so that will be an A3 piece of paper. The screening of the logic model is the reason why we want that. We want to really be able to have a look at those, to compare those, and to assess them. And then part of our looking at those is to see how capable the groups will be of developing an operational plan and seeing if they need any extra support, helping to clarify their work for the operational plan. So we've got CBA training, cost benefit analysis training and support. So that's not all of the groups, but some of them will have that in September. And then the relationship manager support. So you should be meeting your groups very, very soon, certainly before the 24th of July, or at least speaking on the phone. 4.5 days of support for those. That might actually go up. We just need some clarification from the Department of Government and Local Communities on that. It might go up to 6 days. But also, just to be clear on the 4 to 5 days, it doesn't have to be whole days. You know, that could be half days, quarter days. And submitting the draft operational plans on the 30th of October, so that's the day before Halloween. We would like to have a read of those, and that will take time. And we're going to probably be sending a few back to the groups. Then we have the peer review period where they'll work with each other. We'll have probably a physical session where groups can meet each other and have a look at how they're doing and see how other groups are doing in relation to the operational plan. And then the final date for the operational plan to be submitted is the 19th of February. And so that's just after Valentine's Day, probably just after half term 2016. Are there any questions on those dates at the moment? Just type them in if there are. Just to answer Saqib's question, the notes and the slides will be emailed over. What we'll do is release the recording of this, and we've also recorded the sessions we've done with the groups. So though we won't have their voices on that, it will be David speaking to the groups. We'll release that to you as well, and that might help the groups listen to that too. We're going to be using the Gmail G Drive account for some of this stuff That's not quite public because we have the My Community website and all the resources on that for you to pick up on, including that A3 blank um, logic model template. And then anything else will go onto the G drive and you can pick it up from there. So that's not quite as public, but will be accessible to you, and I'll send that through. So we've got a few more questions here.
Yep.
There's some of you haven't had the contacts or the contact details in your areas, and there's an urgency to crack on with that. My colleague Gareth will help with that, and if you would like to email the Our Place inbox, if you haven't had the contact details, then do that. But I would wait until Thursday because Gareth will be working on that on Wednesday. So it's ourplace@locality.org.uk. And then thanks, Chris, for that question. And then Mark says, my group are planning a lot of community engagement work to support their plan. As the draft plan is due at the end of October, it doesn't give much time for engagement work. Mark, let us have a think about that one. I think perhaps if you speak to Jim about that and we'll get the balance right because of course they do need to do a lot of engagement work to support their plan. Do you have any comment on that, David?
No, I think I mean, as I recall, it was one of the things that some of the areas found tricky last year, that they planned a lot of community engagement, but for whatever reason, they didn't get that engagement, and that meant that their development work was delayed a fair bit. So Jim will be more knowledgeable of that than me.
Yeah, we also had some feedback from DCLG about kind of understanding that sometimes the partners need to see partners who might potentially put money into the actions that are going to take place based on the operational plan. They might need to see a bit of work going on first in order to feel comfortable putting that funding into that to show that it will be value for money for them. So sometimes things don't kind of stick cleanly to the deadlines, but we do want to encourage people to do that as much as they possibly can. In terms of community engagement work, we have got some workshops coming up, and those are really by the Outstandingly Good Office for Public Management. Their name's not very exciting, but they are superb. I think we're going to have the 29th of June in Yorkshire. The 27th is in the north as well. We'll email you the details. The 14th we think is going to be in Exeter, and the 16th of July will be in London. So do encourage your groups to go along to those too.
Any other questions, Amber?
No, I don't think there are any other questions at the moment. Thank you very much,
Well,
David.
thank you very much, everybody, for dialing into the webinar. I hope it's been useful and a good refresher. And good luck with supporting areas to produce their logic models and the wider process over the next 9 months or so. Thank you very much.
Thank you. And I'll clarify all dates with an email as well. Thank you. Thank you to everybody who came along to this webinar, and do follow through with any questions that you need. And thank you also for your thanks that you're putting through. That's much appreciated. The recording should be available to you soon if you need it. Any final comments? We'll close the webinar very soon. So just at 11:30. Thanks and bye, everybody. I do look forward to meeting you, and thank you very, very much, David. That was very helpful. End recording.